There's still plenty of confusion across North Texas today after Dallas County reported an enormous amount of COVID-19 cases yesterday. The Sunday count reported more than 5,300 cases, but today, County Judge Clay Jenkins tells me those are state numbers that were backlogged for almost 2 months. The short explanation for the massive amount of COVID cases reported on Sunday is simple, according to Dallas County Judge Clay Jenkins.
It was a big mistake in the state's electronic laboratory reporting software.
The longer explanation, well, that's a tad more complicated. You see, state officials say a combo of not having enough software capacity early on to keep track of cases and several problems with numbers reported from different labs caused the backup. That led to Dallas County having to report 5,361 cases in one day. But as Jenkins clarifies, they aren't all active.
We got cases back yesterday that were months old, but the majority of them were in July. 4,300 were in July, another 600 in August. So another 200 that were more than 2 months or more than a month and a half old.
It sounds like there are a lot of challenges out there. What do you say to folks who are just sort of frustrated with all of this?
It is incredibly frustrated. Nobody's more frustrated, I wouldn't think, than I am right now. But here's the thing. What we know is that masking is working. And you don't have to, even though the state of Texas is pretty screwed up on the data right now, you can look at every other state that's doing masking. It is working.
Jenkins says the backlog in numbers they're receiving is making it almost impossible to conduct contact tracing. So he's asking individuals to help out.
If you have symptoms and got a test, you should not do anything other than isolate from everyone, including your own family, wear a mask at home until you get your results back. If those results come back positive, please contact your own close contacts as well. Unfortunately, what the state tells us is this will be happening some more. They're working through a big backlog. There'll be other days like this until they can get this fixed.
All right, so less than 15 minutes ago, we received this statement from the Texas Department of State Health Services. It said it appears that the formatting issues with these 3 labs have been resolved. DSHS works with labs daily to facilitate reporting of test results to ensure that local jurisdictions receive timely reports. Well, there's a new quick and cheap way to get tested for COVID-19. The FDA has granted emergency use authorization for a saliva test.
As it comes online, I think people will like it much better than the more intrusive nasal swab test.
It doesn't need the same reagents and swabs that have been the rate-limiting step to being able to create testing at scale in this country. It really could be a game changer if we can deploy it.
Well, health officials say the test is expected to cost about $10 and you can get results in less than 3 hours. The NBA actually helped fund the development of that test and uses it now to test its players.